Hey everybody, welcome back to SnotDoc. So if you're watching this video, chances are you or maybe your child have had your tonsils out and you might be seeing some bleeding. So let's get right to the point. There can be different volumes of bleeding. If you're seeing bleeding that would fill this 12-ounce cup or this 24-ounce cup, I highly recommend that you stop this video and call your ENT surgeon's office. If you're actively bleeding and have more than that, I'd recommend getting in your car, heading into the emergency room and calling them on the way. That's obviously more bleeding than should be happening, and we want you to get to the emergency room where they can help you out. Now, if you aren't seeing this much bleeding, but you are having some, you're probably wondering what's going on. Is something wrong? How much is too much? And what can I do to stop it? So this video will go over those things for you and hopefully answer some of those questions. Hello everybody and welcome to the SnotDoc video series. My name is Dr. Stephen Chase. I'm an otolaryngologist, head and neck surgeon out of St. George, Utah. So I've made some videos with postoperative instructions after tonsillectomy, but in doing so I recognize that one of the more urgent problems that people might have is that of bleeding. And instead of watching through a lengthy video talking about postoperative instructions, waiting to get to the part that talks about bleeding, I felt that I should make a video specifically about this alone. So hopefully we can go over a few of those things today. So I'd like to address why am I bleeding, what can I do about it, and how much is too much. So why am I bleeding? Some bleeding after tonsillectomy is actually quite common. A small amount of bleeding can occur within the first 24 hours after surgery. More commonly, however, bleeding occurs in a delayed fashion, often somewhere between 5 and 10 days after surgery. When the tonsils are removed, the blood vessels that had fed those tonsils are controlled in some way. Usually this is with cauterization. During the healing process, then a wet scab forms over the raw surface where the tonsils used to be. Now when that scab comes off, occasionally the blood vessels open up and you see some bleeding. Now let's review. There are two types of blood vessels. There are arteries that are coming from the heart, which are under pressure. And then there are veins that are returning blood to the heart, which are at a much lower pressure. Now you can see bleeding after tonsillectomy from either of these two. Typically if you have venous type bleeding, it's kind of a slow ooze, maybe a darker colored blood, and it'll generally resolve on its own without much intervention. Now if you have bleeding from an artery, this is usually a lot more brisk, bright red in color, and it can be slower to stop. Certainly the size of the vessel can contribute to this as well. So other factors that can contribute to bleeding include blood pressure, blood thinning medications, and any clotting problems that you may have that occasionally run in families. So what can you do about it? So I like to prepare patients to almost expect to see some bleeding, so when it occurs they're not overly surprised. Trying to stay calm and relaxed can be helpful as it'll keep your blood pressure down, which can slow bleeding. I do recommend grabbing a cup or something available that you can spit or bleed into. This allows you to keep track of how much you or your child is bleeding. Now, certainly I recognize that with this you're collecting a fair amount of saliva as well, but it generally gives you a feel of the volume that you're having. Now, once you've done that, I recommend going to ice or popsicles. The cooler the better. Cold helps constrict the blood vessels going to the area, specifically those arteries that I mentioned, and that effectively again slows the blood flow to the area and decreases bleeding. Occasionally getting ice water and gargling it can be helpful as well for the same reasons. Another thing that I highly recommend is actually using ice on the outside of your neck for similar reasons. A bag of ice or frozen peas again over your neck will help decrease the blood flow to the area and slow bleeding. Once the bleeding is stopped, I usually recommend resting for a while, not doing a lot of activity that would increase blood flow for several hours, or maybe even the rest of the day. And I also recommend continued use of ice chips or popsicles, things like that to keep things cold. I will mention that it's also fairly common to have some bleeding which stops only to return a few minutes later to a few hours later. We generally feel that when that occurs that the little clot that formed has fallen off, which allows the bleeding to resume. Again, I would recommend treating it the same way. Typically over a short time the clot seems to hold and you won't see any further bleeding. Okay, so how much bleeding is too much? This is actually a subject of debate because it really depends on the individual who's bleeding, whether you're dealing with a child versus an adult, and each ENT surgeon probably has their own opinion. So the right answer is to confirm what your individual surgeon feels is too much. For myself, I tell patients to accept to see a teaspoon or tablespoon of bleeding quite commonly. Generally, this is able to stop, sometimes with some help, as I mentioned, and you really don't have to worry much more about it. Now, if there's more bleeding than that and you're getting, say, half a cup of blood, which is 4 ounces, or certainly a cup, which is 8 ounces, I ask that they call my office. We want to know about that. Now, thankfully, the bleeding is usually still able to be controlled, but it gives us a feel of how the person is doing, and we can guide them moving forward. And sometimes that requires sending them to the emergency room for evaluation. One last word of comfort, that the bleeding won't hide. Occasionally parents have concerns about their children bleeding through the night and them not being aware of it. While this happens, typically children will swallow the blood, and the good news is our stomachs don't like a lot of blood, and so we tend to throw it up. So if there is really any bleeding of significance, you will know about it. Certainly if you have any other questions, please contact your surgeon's office for their specific advice. All right, everyone, I hope this video was helpful. If so, I'd love it if you hit the like button, and certainly also feel free to subscribe to be alerted to new videos that become available. And as always, until next time, keep your nose clean.